When you get this device, to set it, press the two left buttons at the same time and then the right button until peak appears. Once peak appears, you turn it off, and then when you turn it back on, it will be set so that when you pull it, it goes to peak hold. Then, to set units, you just hit the right button until you have kilograms or pounds. I like pounds. So to do this test, you have a patient seated, tibia's vertical, legs vertical. You keep the heel on the ground, the forefoot on the ground, both sides. You take the device, you place the device, the card, under the tips of the second through fifth toes, and then you say, I want you to keep your heel on the ground, forefoot on the ground. I want you to stop me from pulling this card out. So as I pull out, the person resists, and you just measure peak hold. Then you repeat the test, opposite side. Don't let the great toe get involved. So that's it. Keep the heel on the ground, the forefoot on the ground. Stop me from pulling this out. Stop me. Beautiful. Moderately symmetrical. The main thing you want to look for is if there's been a metatarsal stress fracture, you're going to see 20 to 30% strength asymmetries, or if there's a history of plantar fasciitis, you are also going to see up to 50% strength asymmetries. So to convert the ToePro dynamometer into a dynamometer you can use to measure piriformis strain, just take the plastic card that comes with it off and then replace it with the ankle cuff just by pressing it like that. Now you're all set to do the test. To test strength in the piriformis muscle, if a study came out in the American Journal of Sports Medicine showing that if you couldn't generate 20% of your body weight with this test, you were significantly more likely to get an ACL injury. I personally feel that the whole lower extremity is likely to get injured because you lose control of the lower limb in the transverse plane. So to do the test, you have the patient pull their hands out for stability, get the tibia so it's vertical, have the knees right to the edge of the table, then put a little cuff just above the medial malleolus, and turn the measuring device on. They have to generate 20% of their body weight, so how much do you weigh?
About 110.
So we're going to go for 22 pounds with this test. Leg stays vertical, you pull in with your ankle as hard as you can. Harder, perfect, and relax. And you repeat it on the other side, but with that test you got 22 pounds, which is perfect. And let's do the other side. Pull in, and stop for 1 second, you were just too strong. Broke the machine. And pull in as hard as you can, and relax. If you don't say as hard as you can, people don't try as hard. Nobody ever talks about that with muscle testing, and that was 22.9, so she is well within the reference range. You also can repeat this test with hip abductors. So you're going to lie with your right side up. You're going to rest your head right up here. Hip abductors should generate 35% of body weight. To do this test, you take the strap, you put it 10 centimeters above the joint line. I've already measured a spot and marked it. It's right here. So the leg gets abducted. You turn the machine on, get your hands in good positions for stability, just like come out of the way just a little bit. Now lift up towards the ceiling. Lift up and relax. And with that test, they should be 35% body weight, which she is.